Part 2 of Module 1 is Introduction to ADHD, looking at what it's like to have ADHD, myths around ADHD, and the common terms used. This video is 11 minutes long. So what does it feel like to have ADHD? The next video showcases various examples of how ADHD manifests, highlighting that it can be different from person to person. What's it like to have ADHD? ADHD affects each person uniquely, and its impact on their life can vary greatly. Some people say it's like having racing thoughts all the time, like a TV with lots of channels on, at the same time constantly changing, and you don't have the remote to turn it off. Or others describe it as a hobby graveyard, intensely interested in something, and very soon after you've given up or lost interest. Or some describe it as being daydreamy and easily bored and distracted. For others, it's being forgetful, struggling to be organized, and difficulty starting and finishing tasks. For some, it's always being on the go, never being able to sit still. Or maybe it's being impulsive, like interrupting people when they're talking or blurting out answers in class. Or maybe it's feeling stressed and disappointed in yourself because you start multiple projects at the same time and don't complete any of them. For some, ADHD can be physically and mentally exhausting because of the effort required to focus, stay organized, and get things done. For some, it's focusing on the wrong things. So rather than completing the urgent assignment, you reorganize your pencils. For others, it's being really creative, thinking outside the box, and solving problems in unique ways. ADHD, despite its challenges, can also bring some positive traits and strengths to individuals. Dr. Hallowell, a world-renowned ADHD expert, said that ADHD is like having a Ferrari engine for a brain with bicycle brakes. The aim is to strengthen your brakes so that you can master the power of your ADHD while avoiding its pitfalls. For those of you with ADHD, maybe some of the things from the video will be familiar or strike a chord. If you're a parent, family, or friend of someone with ADHD, hopefully it'll give you some more insight. ADHD is a highly individualized experience, and no two people with ADHD will have the same symptoms, challenges, or strengths. For people who have ADHD, it's sometimes hard to understand and even harder to explain to others what it's like. Understanding how ADHD impacts people will help foster compassion and empathy, reduce stigma, and give people knowledge and skills they need so that they can provide meaningful support. So what's it like for you having ADHD? This is on the Module 1 activity sheet. So question 1 is write down all the good things and the challenging things about ADHD. How did you feel when you were diagnosed? And did you want anyone to know? Please pause the video now and complete this. See you soon. One of the major hurdles in addressing ADHD effectively is the stigma and misunderstanding fueled by myths and misconceptions. This video will tackle and debunk some of the most common myths. Myths about ADHD. ADHD is not a real condition. It's a neurodevelopmental condition and has been described in medical journals since 1902. And since then, over 10,000 clinical and scientific papers have been published. Everyone has a little ADHD. While everyone might sometimes have trouble paying attention or controlling impulses, those with ADHD face these challenges more consistently and severely. Equating common behaviors with ADHD downplays the real struggle that people with the condition go through. Children with ADHD eventually outgrow it. Research shows that around 80% of individuals who have ADHD in childhood continue to have symptoms into adulthood. ADHD is a neurodevelopmental disorder, so it does not go away, but coping mechanisms may get better and symptoms may lessen. Children and adults with ADHD are overmedicated. According to the latest data from the CDC, the Center for Disease Control and Prevention, it is reported that approximately 62% of children aged between 2 and 17 with a current diagnosis of ADHD actually take ADHD medication. For adults, the percentages vary, but overall, it is lower than for children. So many people diagnosed with ADHD are not taking medication. ADHD meds lead to addiction. It's quite the opposite. Having untreated ADHD increases the risk that an individual will abuse drugs or alcohol. The medications used to treat ADHD have been proven safe and effective over more than 50 years. Girls have less ADHD than boys. ADHD in girls and women has only been recognized in the past few decades. Boys are diagnosed 3 to 4 times more than girls, even though research is starting to show that girls are just as likely to have it. Girls usually have the inattentive ADHD and may seem more daydreamy. As a result, they're just more likely to be overlooked and remain undiagnosed. ADHD is a result of bad parenting. ADHD is rooted in brain chemistry, not in discipline. When a child with ADHD blurts things out or gets emotionally overwhelmed, it's because they cannot control their impulses, not that their parents can't control them. Someone who can play video games for hours can't have ADHD. ADHD does not mean no attention, it means dysregulated attention. Environments or activities that are highly stimulating can actually lead to hyperfocus. People who have ADHD are stupid or lazy and will never amount to anything. This couldn't be further from the truth. ADHD is a neurodevelopmental disorder, and people are not lazy or stupid. Many well-known, high-achieving individuals have had ADHD, including Mozart and Abraham Lincoln, as well as some of the most successful business, sports, and creative people. For them, ADHD is their superpower. ADHD is a learning disability. ADHD is not a learning disability, but some learning disabilities often co-occur with ADHD. So around 40% of people with ADHD also have dyslexia. What myths did you believe? Please take a moment to complete the activity for Module 1 activity sheet, which is question 4. Write down which of the myths listed below you thought were true. Are there any other myths you believed? You might want to pause this video just to complete this and then come back. Now we're going to move on to the common terms used when health professionals talk about ADHD. Things like neurodivergent, neurotypical, executive function dysregulation, prefrontal cortex, neurotransmitters, and DSM-5. Don't worry if they sound complicated or you're not familiar with them. We'll cover each of these in detail. So let's look at neurodivergent and neurotypical. Neurodivergent is a term that refers to people whose brains work differently from what is considered typical or more common. There may be conditions like ADHD, autism, or dyslexia, which affects their learning, thinking, and processing in unique ways. Neurotypical is a term used to describe people whose brains function in a way that is more common or typical in society. Being neurodivergent or neurotypical doesn't make anyone better or worse, it just means they have a different way of thinking and experiencing the world. ADHD has its advantages in specific situations. People with ADHD can have energy, motivation, quick decision-making, and a drive to explore and innovate. And these traits are essential for human survival. But in traditional neurotypical settings like classroom and workplaces, where they're asked to sit still and be quiet for long periods of time, having too much energy and spontaneity can be seen as difficult or challenging. The challenges that people with ADHD experience can often be more about environmental expectations rather than being differently wired or having neurodivergent brains. The DSM which stands for the Diagnostic and Statistical Manual of Mental Disorders, is a standardized classification system used by mental health professionals to diagnose and categorize mental health disorders. It contains specific criteria for ADHD diagnosis, which helps clinicians determine if someone has the condition. The current DSM is a DSM-5 or 5th edition, which was published in May 2013. While there have been some updates on other mental disorders since then, there have been no major updates on ADHD in the DSM-5. However, mental health professionals often consider the latest research and clinical guidelines in addition to the DSM criteria when diagnosing conditions like ADHD. There's a common misconception that ADD, or attention deficit disorder, is a medical term still used today to describe those with a condition but without hyperactivity. To understand it, let's explore the history. ADD was a term used in the early 1980s and was part of the DSM-3. In 1987, the term was changed to ADHD in the DSM-4. Even though ADD is no longer an official diagnosis, some people still use it when referring to ADHD without hyperactivity. This condition has been recognized for a long time, dating back to as early as 1798, when doctors observed individuals who struggled with distraction and focus issues compared to others.